Hi guys, in this video we're going to talk about the descending tracts of the spinal cord. What are the descending tracts? The descending tracts are the motor tracts that will help us to do functions. Okay, we have pyramidal tracts and we have extrapyramidal tracts. Okay, what are the names of these tracts and why do we call them as such? And what is the specifications of each one and the other groups? We're gonna see that as we proceed. So the first tract function, which is the corticospinal tract, is to help you to do a skilled movement. The difference between this and the others, at the end of the day, all of them will help you to do motor function. All of them, they will make you to move your muscles. But if you want to write something on a piece of paper, if you want to cut something, if you want to do some crafts or something, you need to use the corticospinal tracts because they are important to do a skilled movement. However, in order to bring your arm into something and hold it, for example, the other tracts will more or less help in moving the arm to that place, for example. So we will have muscles that will activate the flexor groups. We have like the rubrospinal tracts, okay? Yeah, okay. So like the rubrospinal tracts, we have a group of muscles that will help you to move. We will have muscles that will help you to activate the extensor group. I don't have, yeah, I have a picture that will help you to activate the extensors group of muscles. Okay, we will have the reticulospinal tracts, okay, that will help you. Of course, you guys know now what do we mean by reticulo, صح? It's very important for consciousness and to control and kind of interpret everything together, you know. The reticular formation, remember you guys that one, صح? We have, you know, the spinal-reticular and you know the reticulospinal. You know the spinal reticular that brings information about the spinal cord and what's going on there into the reticular formation, connecting them together. And then from the reticular formation, you're gonna tell your body and the spinal cord that I'm awake, I'm conscious, I'm aware of everything. Go ahead and do this, go ahead and do that, go ahead and respond to the other tracts. This is what the reticular formation is doing. So it's kind of controlling your voluntary movement. It's telling you, go ahead and react. Someone is talking to you, listen to that person and talk. If you're just awakened from general anesthesia, let's say, okay, so here you are bringing the reticular formation back and you are interpreting everything back and you're aware of everything back. And that is kind of activating the motor systems. And that's why the reticulospinal is kind of confusing for some people, but in that way it will be easy for you to understand what does it do. And then the tectospinal tract is important for your postural responses to visual reflex. Remember when I told you if someone is showing a red flag or if there is a fire somewhere and you got the information and you have it to the tectum of the midbrain to the superior colliculus and you came to know there is something. Okay, so now you need to react, right? Okay, so you get the sensation already. You get the sensation already from the spinal cord. You get the sensation that there is something that I need to react to it, that I've seen. Okay, so you got this to the superior colliculus because superior colliculus of the midbrain is the visual reflex center. So now in the superior colliculus itself, you are going to send interneurons to these tectospinal tracts, and of course there will be communications with other stuff. We will get into that later on. But then from here, from the tectospinal, you are giving the from the superior colliculus information through the neurons, through motor neurons, because anything that has function, anything that comes from the brain and brain stem and any higher center to my spinal, it should be motor, guys. Don't get confused between the sensory and motor information, okay? So that will give you postural responses. Now you got the information from the superior colliculus and you're getting that to the spinal cord and then you are giving this information to the spinal cord segment, and from the spinal cord And from the, I'm trying to write what's happening. Okay, so, and, okay, so what happened? It's not correct. Okay, and so you're getting from the tectospinal, all right? What happened? Yeah. So you're getting this from the superior colliculus. You got the information, tectospinal, into here. And then once it gets to the spinal cord, from the anterior horn cells, you are going to control your neck muscles, and that will make you to respond to that visual stimulus. Okay? So this is what happens in a simple way for by the tectospinal tract. So these are the functions of the tract. So as a recap here, I was saying something at the beginning and I stopped at it when I found myself getting into pictures about the functions of the tracts. Rubro, you guys, in Latin means red in color. So rubrospinal, it means the information is coming from the red nucleus, okay? So rubrospinal, red nucleus is also in the midbrain. So that's why we call it rubrospinal. It's information that's coming from the red nucleus to the spinal cord because it wants to activate a group of muscles. Remember that the rubro is opposite to the vestibulo. يعني these two, they are opposite to each other. The rubro are, it activates flexor muscles groups. The vestibulo, it does not have R. This is for extensors muscles groups. Extend, okay? You guys know what are the extensors, right? You know what are the extensors muscles. The muscles here are the extensors. The anti-gravity muscles are all extensor, right? And the flexor group, you know them. And so rubro, from the red nucleus to the spinal cord, vestibulo, from the vestibular nuclei to the spinal cord, and then you have the reticulospinal. We talked about that, from the reticular formation, which is scattered in the brainstem. The tectospinal comes from the superior colliculus to the spinal cord. And anything related to the superior colliculus is related to your eye. And remember that when you get into the midbrain, you have two levels, superior colliculus level, and inferior colliculus level. I always like to teach it this way to my students. Inferior related to the auditory stimulus, superior is related to the visual stimulus. Okay, so tectum, the tectum has superior colliculus, inferior colliculus. I said that in the intro, and we will say it one more time, a couple of times, of course, in the midbrain. But remember that what you have in your body, the eyes are superior to your ears. So superior colliculi, superior one colliculus, two colliculi, this is related to the visual stimulus, eye. And inferior colliculus, the ears. Okay, so this is what's making visual responses in response to, postural responses, Postural responses, because what you're doing here is motor, صح? These are motor tracts. What you're doing here basically is you're giving information to the muscles to work. These are descending tracts. You want to control, you want to do an action of the muscle because you want muscle contraction. The corticospinal tracts are different than everywhere else. They are pyramidal tracts. All of these are extra pyramidal tracts. And I will explain that into more details and we will say why we call it as such. Okay, so these are nice pictures to show you what do we mean by these functions. Let's go ahead and understand about the pyramidal. Why do we call them pyramidal tracts? Because these tracts are formed by the pyramidal cells of threads. We have important pyramidal cells in the cerebrum. These cells are called pyramidal cells. These are the cells, the neuronal cells that forms your corticospinal tracts. That's why we call them pyramidal tracts. Okay, these are pyramidal tracts. The corticospinal tracts. We have lateral. We have anterior corticospinal tracts. The lateral here, most of the tracts coming from the cortex are lateral. Few of them, they form anterior corticospinal tracts. The corticospinal tract, the lateral ones, they cross at the medulla, and we're going to talk about them in medulla. So 85% of the corticospinal tracts, they cross at the medulla and they descend as lateral corticospinal tracts. And from here, they will go to the anterior horn cells and they will give to the lower motor neurons and you will do function. However, 15% from the anterior corticospinal, they descend without crossing, but at the spinal cord level, they will cross, and then they will give to the other side of the anterior horn cells. So at the end of the day, if we have, we're going to talk about the lesions later on, but these are all crossing fibers, and the lesion is going to be contralateral if you are at the level of the spinal cord. We're going to talk about the lesions later on, okay? It's not like the cerebellum. The cerebellum is ipsilateral. If I have a problem in my cerebellum, it means I have a problem in the same side of my body. But the corticospinal tracts, they cross, and we're going to talk about them. Now, what about the extrapyramidal? It means something that is not pyramidal. Some motor tracts that are not pyramidal. What are these? I have one of them running with the lateral corticospinal, which is the rubro. It's the only one that runs close to the lateral corticospinal. So we call it lateral systems. These are all lateral systems. They are lateral. And the rest of them are all moving medially. Remember this nice cross-section of Snell book, Neuroanatomy book? This is all ascending tracts, and these are all descending tracts. Now we're talking about the descending tracts. Descending tracts are very cute and they are very simple. We only have upper motor neuron coming down, and then we have lower motor neuron when it comes to the corticospinal. And for here, we are getting information all the way through the tracts, and we get them to the anterior horn cells, lower motor neuron. So in descending tracts, we only have two order neurons. Upper, if we are bringing information from the cerebral cortex or from the brainstem, and lower motor neuron, if the message has been successfully reached the anterior horn cells, and from here, these neurons are going to exit from the anterior motor route to the muscle. This is how simple and easy the descending system is. And even the ascending system is very easy, but there is just differences between them in terms of where they stop and where do they cross. That's the only thing. Other than that, it's easy as well. Okay, but the descending tracts, nothing. It's just you have the tract that starts from the name of the brainstem center or from the cortex, and it stops at that level and the anterior horn cells where they get in there and they reach. Whether they cross or no, we will say that now. And then once they reach the anterior horn cells, you give the information to the lower motor neuron. It's two order neuron, okay? Pyramidal tracts are the corticospinal. They are for the skilled movement. If you want to execute something in a very skillful way, you need them. However, for broad movements, if you want to beat, or if you want to move your gross muscles of your hands and bring the proximal muscles, bring your arm to a place where you can grasp something small, the huge muscles are controlled by the extrapyramidal tracts. Okay, but the corticospinal will be taking care of the small skilled movement that needs your hands and fingers and so. Okay, now regarding the crossing, like I said previously, the corticospinal tracts, 85% of them, they cross at the pyramids. I'm not gonna tell you how do they cross at the pyramids because that is gonna be covered in medulla. But like I said previously, 85% of them, they cross. And then, like if we say that this is my brain, okay, this is my brain, I have corticospinal tracts. I got information from the motor areas and also some from the somatosensory area, and I will tell you why. And once you have the corticospinal tracts reaching the medulla here, 85% of them, they cross at the medulla, 85, and 15% they don't. Once they reach the 15%, the spinal cord here, they will cross at that level. At that level only they will cross, and then they will give to the anterior horn cells. Okay? Do you want me to do it again? Okay, here we have, this is the cortex. These are the corticospinal tracts formed by the pyramidal cells. That's why we call them pyramidal tracts. They give you the information. They will descend down, and of course you have the brainstem first. Here is the brainstem, At the medulla down here, most of them will cross, 85%. Once they cross, okay, they will give you, if this is the spinal cord, okay, they will give you here as they cross the lateral corticospinal tract, as they cross, lateral corticospinal tract. And if they cross already, then the second order neuron, they will cross at that level, and then they will give the information to here, the anterior horn cells, and from here, they will exit because they've already crossed at the medulla. Okay, these are the lateral corticospinal tracts. Now, if we have the small amount of the anterior, they are also corticospinal tracts. They will descend without crossing. Once they reach here, the spinal cord, they will cross to the other side, and then they will exit. If it's coming from here, they will descend anterior, and then they will cross to the other side, and then they exit from the motor route. All right, guys, we have upper motor neuron and lower motor neuron. This is the difference between the upper and lower motor neuron. If my motor neuron is starting at the level of the cortex or at the brainstem level, this is upper motor neuron. If it's starting in the anterior horn cells here, this is lower motor neuron. This is the final neuron that will go to the muscle and make me to do function. It's very important you know the difference between them, and we will talk about them in details as we proceed. Where do they get their information? We get the information from the primary motor area, from the premotor area, and from the somatosensory area. Why we need it from the primary? Because this is important for the function. The primary motor area will tell you what to do. Why from premotor? Because the premotor is the place where you need to plan for the movement. So you need to get information about how your body wants to plan for that movement. Why from the somatosensory area you need to get also some corticospinal tracts and pyramidal tracts? Because you guys, if you need to do a function, you need to be aware of the sensation all the time. Let's say that you are trying to do something with sharp pens, for example, okay? Now, you don't want to harm yourself. So I want to craft something that has pens, okay? And because my corticospinal tracts are getting information all the time from the somatosensory area, if what I am doing is harming my fingers, I'm gonna stop. I'm going to reduce the degree of pressing over that pen, for example, to do the craft. I'm going to go ahead and try to put something on my finger to press on that pen to do this design, or for example. So it's very important that we keep track of things. We need to get information, and the corticospinal tracts themselves that are going to go all the way to my finger muscles and tell me what to do, they also need to be aware of what the sensory tracts are telling them about the sensation of the thing I'm doing. This thing has to be connected. So that's why a huge amount of corticospinal tracts, upper motor neurons, are coming from the somatosensory area, because we need to be aware of the sensation before we go ahead and proceed with the motor function. Okay, and that applies for all kinds of you guys, the motor function. It's not only if we are crafting or something simple like that. It applies for all of other functions that we need to do, and I don't want to dig deeper into so many examples. If you understand this is more than enough for me. Okay, so in the lateral system, we have two tracts, lateral corticospinal tracts that they already decussated at the medulla, and we're going to talk about that later on. And they have interneurons, like we said, to reach the anterior horn cells. And anterior horn cells will give you what? The lower motor neuron. That will give you through the motor route to your nerve, whatever nerve you have. If you are in your hands, and let's say the median nerve, or it depends what kind of muscle you are acting on, this is going to be the motor route to that nerve, and it's going to go ahead to your muscle, and you will do the function. Okay, so what am I? This is rupro. Okay, so the lateral corticospinal, it comes all the way here, like I drew previously. It descends down, and then it crosses at the medulla level. It reaches the lateral corticospinal. By interneuron, you can reach your lower motor neuron. It's just two ordered neurons. It's upper motor neuron and lower motor neuron. And the extrapyramidal tract, this is your upper motor neuron and this is your lower, because that brings the information from higher centers, from the brain stem. And this brings the information at the spinal cord level. And at the end of the day, rubro will facilitate flexor muscle group, and the lateral corticospinal tract and also the anterior corticospinal tract will make you to do the skilled movements. Okay. So what do the medial tracts do? They control the axial muscles and the girdle muscles. Remember, I told you previously, if let's say that you want to go ahead and grasp something for your craft, you want to craft something like the beautiful girl that was sitting and crafting. The tracts that are other than the corticospinal tracts, they will affect your big muscles, the girdle muscle, the shoulder muscles. They will take your hand, the whole arm, to the paper and help you to grasp that paper. If it's a flexor muscle, rubrospinal tract. If it's an extensor muscle, vestibulospinal tract. If it's be aware of anything and every time, it's going to be reticulospinal. So reticulo is both. TIC2, of course, related to the visual stimulus. But for the anterior corticospinal tract, what we notice that is that they mostly control the cervical and upper thoracic region. Okay, so the anterior but that thing isn't mentioned in a lot of context when it comes to injuries and so on. I don't know if this information is important for you or no, but at the end of the day, if you have a problem with the corticospinal tracts, you're gonna have a problem with your skilled movement, okay? And if you have a problem with the extrapyramidal tracts, you will have, of course, problems, but that will be related to the extrapyramidal, and we're gonna talk about the injuries as we proceed. I just want to say something about these tracts. It is that for the crossing, guys, for the crossing, if you guys look at, remember we talked already about the corticospinal. We said that most of them, they cross at the medulla, and then once they reach down, خلاص, it's done. Or if they are anterior corticospinal, they will cross at their level, and some of them will cross, and then they will give to the other side. Okay, not sure about what's that at the same level. But corticospinal tracts, they cross. They whether cross at the medulla, which are the lateral corticospinal tracts, and the anterior, they cross at the spinal cord level. And some of them, they are uncrossed, maybe. Okay, so just give more attention to the lateral corticospinal tracts, and this is about the corticospinal. Now, what happens to the vestibulospinal and reticulo and tecto? The tectospinal tracts, they would come from the spiculiculus and cross. The reticulospinal tracts, some of them they cross and some of them they don't cross. Vestibulospinal tracts, they don't cross. But the rubrospinal tracts, they cross. I didn't show you this here. The rubrospinal tracts, they cross to the other side. So if there is a lesion, it's gonna be contralateral. That is not gonna be mentioned in the spinal cord, and I'm not sure if you need to know this information about the extrapyramidal tract or no, but rubrospinal tracts, they cross, and because they are R, I used to remember them this way, they cross, and the rest of them, they don't cross, okay? The other ones, they cross. The reticulo, some of them, they cross, and some of them, they don't. Anyway, and now, so these are the tracts, and it depends where we are going to start. If we are at the vestibular nuclei, this is vestibulospinal. If we are in the supracolliculus, this is tectospinal for visual reflexes. Vestibular, we will go to the vestibular muscles, anti-gravity muscles, that will help you to balance yourself to, because it's the anti-gravity muscles, okay, for extensor muscles. They will help you to activate the extensor muscles, and we're gonna get deeper into the vestibular system, and we're gonna get deeper into the brainstem. So don't bother yourself much about things. Just make sure to know the function, the pathway, and what's gonna happen later on. That's if there is a lesion, we will take it in the next videos. That's all you need to know as for now, okay? And again, like I said, for the somatotopic organization, in this part here, we have it for the ascending tracts. Remember, if something is important to me, medial to me, it's higher in my priority list. So everything medial is higher. So cervical, thoracic, lumbar, sacral. And for the posterior column, remember the graceful legs, the gracile is medial, the legs are here, T6 and below, and the cuneate is lateral. Of course, this is ascending posterior wide column, but I just like to connect everything together and repeat everything so that by the end of this, everything becomes easy for you. And yeah, and I think, yes, we are done with the descending tracts. Thank you guys for watching. They were so much easy. Let's go ahead now and see the next video, because in that you will appreciate and understand with the lesions, everything is gonna be more important and more easy. Okay, so we will say that in the next videos. Thank you guys, and see you in the next videos.